I see we are on the air. Winnabuju and way Maganaduk, Madaway Benezi, Indigenous cause, Name Dodem, Anishinaabe and Down Neopit in Donjapa. From originally born in Neopit, Wisconsin, myself, now live here in the Milwaukee metro area. Mark Denning, welcome everybody. It's good to see you. Jeremiah is here, working hard, and I believe our windstorm in southeast Wisconsin disadvantaged a lot of folks for a lot of different reasons. And there's also a lot of things going on in Indian country around COVID-19. And I know we got a lot of questions because school's starting, young people are going back to college, colleges are open. And so what do we do about that? It's some big questions. And what do we do, once again, to be safeguarding our families in the very best way? And the first place to start, I think, is awareness. And just a side commentary that isn't so much to the side. Just last weekend, there were to be 2 powwows that would have been held in Wisconsin. One in Stockbridge, their traditional annual. They were looking forward to that. That was canceled because of healthcare reasons. And the second one was in Carter, Wisconsin, and that was not canceled. We'll be talking more about that later on because there are consequences in our Indigenous life, and there are smart ways to deal with those things and not in a shame or blame at all. Our tribal leaderships are working hard to keep our spirits up, to see that we are checking in with each other, and those powwows have come to be our community well checks. And I don't think there needs to be any fault assigned to organizations or places that are going forward with the best information they had, but things happen. And so with that, I'm going to turn this over to Jeremiah and Dr. Ignace, and let's talk about these things later on, because there are far more important things that are happening right now that we can do about right now. And that's why I'm glad you're here. And if you do have questions, please remember, move your cursor around on your computer screen. Hit the chat bubble, and as soon as that question occurs to you, just write that in, and we'll get to that just as soon as we can after our formal presentation. Dr. Ignace?
Sorry, on mute, rookie mistake, right? Yeah, Mark, thanks for the introduction. A lot of things did happen over the last couple of weeks, and it's impacting not just here in Wisconsin, but throughout the entire Bemidji area, including Michigan and Minnesota. But like Mark was saying, decisions at the time are being made in the best of light with the information at present. And it's pretty clear what's going on right now. Everyone is acutely tuning in to what is going on. And a lot of things have occurred, not only from the government level, but what's going on around the country. And it's going to be impacting all of us really, really soon. If it hasn't impacted families already, mandates are coming down, and they're coming down pretty quick. And we're starting to see that as a result of the latest surge in infections with the Delta variant. And people are starting to wonder, we were close to that, as close as we've ever been to kind of closing the door on this virus, but it has creeped its way back. And I just want to talk real quickly about infections. And a lot of discussion has occurred about people who are currently vaccinated and to individuals who are unvaccinated. And I think it's pretty clear, and the information that is in the data that's being gathered is pretty clear about where these infections are coming from. So we know about breakthroughs. Everybody's heard about breakthrough infections, and breakthrough infection is defined by an individual who has been vaccinated and still gets the COVID-19 infection. Now, I think what people have to realize how this is occurring is as many people as we currently have vaccinated to the number of breakthrough infections, we are essentially talking about 0.098% of all people who have been vaccinated have shown to get COVID. Now, that is a pretty low number. And that, in fact, that is a really low number, given the number of people that have been vaccinated. Over 160 million people now, and we're talking about over 150,000 infections that have occurred. We may know individuals that have occurred. In fact, I've seen cases of people who've been vaccinated and have gotten COVID. So it is a real thing, but at the rate at which it's happening, it is remarkably still kind of a rare occurrence for people who are vaccinated to get COVID. So the vaccines are still very effective. They are still protected, not only getting the primary infection, but also getting secondary severe complications that would require hospitalization or ICU or even fatalities. And so a lot of what is occurring here in the United States as is primarily the result of what we're seeing from unvaccinated individuals. So I want to reiterate this because it is the common theme. What the data is showing us: 99.5% of COVID-19 fatalities are related to the unvaccinated population. 97% of all hospitalizations are due to unvaccinated individuals. So it is pretty clear that what we're seeing right now from the Delta variant is that we're seeing a great portion of the cases, and as a result, hospitalizations and fatalities to unvaccinated people. Now, you're wondering, well, what about the individuals that are vaccinated? They're still getting hospitalized. Well, if you look closer at the information as to what this is, these are individuals that are older, and we're talking about 50 years of age and older, who have pretty significant underlying medical conditions, whether that would be immunocompromised states, coronary artery disease, diabetes, much of what I've been talking about as far as chronic conditions. Now, in addition to that, we're also seeing people that are requiring a little more hospitalization are individuals that are 65 and older. These are the elder population, and what we're finding is the immune level protection wanes, particularly in the older population. So I know the CDC and the FDA are coming out with new recommendations looking at boosters, and this shouldn't be so surprise, because this is already occurring in Europe. It's occurring in Israel. Israel's already has approved the third booster shot for individuals who are immunocompromised or who are of 60 years of age and older. So this is an ongoing activity that's occurring in Israel already, and this is going to be occurring here in the United States pretty soon. So there will be a third dose of vaccine offered to individuals that are of an immune compromised state, as well as individuals who I'm not sure, I didn't hear what age cutoff it was, but I'm assuming it's going to be 60 years of age or older, but I'll wait for that final announcement to come out. So we know about the infections. Where are they occurring? And it's pretty much across the board everywhere. You hear about high transmission rates. Well, it's everywhere. There's really only a few states that are low in transmission, but we're talking about states like Florida, Texas, California. And if you look even a little more closely at these states, we see that it's also the southern belt from Texas all the way to Maryland. So We're talking about states like Louisiana, Georgia, North Carolina, Alabama, Tennessee, Missouri, South Carolina, Mississippi, Arkansas. So that whole area is really starting to take off. Now, if we look at like what is Wisconsin doing, we see Wisconsin's kind of ranked 26. Our numbers have gone up in the last couple of weeks, and so we've moved up comparatively to other states. Minnesota, Michigan have remained relatively stable in the same spots. And again, looking, and right now it's all about vaccines. It's all about the vaccine rate. Who's getting vaccinated and who's not. So looking more closely here at the state of Wisconsin. This is a heat map. Purple indicates the darker the purple, the higher the vaccination rates. The lighter purple indicates a much lower rate of vaccinations. And you can see it varies. It varies throughout all parts of the state. But what I think what's important is when you start correlating major cities with vaccines, you can see that there starts to be kind of a correlation between rates of vaccine to areas of lower population with lower rates. So if we look at Milwaukee, now this is the one area that I would say probably deviates from high city, high rates of vaccination, just because a good portion of the state's population resides in Milwaukee County. But when you start looking really, really close at the heat map here, we see there is a segment of Milwaukee County that has really low vaccination rates. And on the flip side of that, we see that on the right-hand side, we see the red to light orange heat map indicates where are the infections occurring here in Milwaukee County. And we see that if you look at both these heat maps and you look at overlapping both of them, they correlate really well between low vaccine rates to high infection rates. And this isn't unique to Milwaukee. This is occurring throughout the entire country and in most major urban centers. So this is a bit concerning because we want to assure that we have not only vaccine available, but also the ability to protect the population in the communities that we reside in. So if we look at the infections and we look at more specifically to what is causing the infections, are we talking about the original virus now? Are we talking about the B117, the UK alpha variant? Or are we talking mainly, is it just Delta? Now, if you look at this profile here of genetic sequencing, if you go left to right, we see January of 2020 all the way to July of 2021. So you see all of these varying degrees of primary variant. And as you get closer and closer to the right, we see this really dark blue, just the entire column is entirely dark blue. Well, there are still original wild type virus circulation still present. We have kind of smatterings of small numbers of variants, other variants, but the primary one, the absolute primary variant and leading virus that is causing infection here in the state of Wisconsin is the Delta variant. Without question, pretty close to 80% of all new infections could probably be contributed to the Delta variant. Now, they don't test sequences on every single positive case. They do take random samples, but it does correlate to infection to positive tests to more than likely the genetic makeup is of the Delta. and this is again not unique um, um, to Wisconsin. This is throughout the entire U.S. population. So this is an ongoing infection. Delta is here, and what we're seeing is primarily, I mean, even at our own clinic here, we're getting more and more calls for testing. There was probably a good period of 3 weeks, almost going on 4 weeks, where we didn't get a single call for a test. And so things had remarkably slowed down, but in the last 2 weeks, those numbers are definitely growing, and we're getting a lot of calls now regarding testing, whether people have been exposed as well as to people who have symptoms as well. So we are seeing a lot of activity as we did back in almost a year ago, August, September, when things were starting to ramp up even here in the state of Wisconsin. We're kind of getting back to that same level a year ago in terms of activity, in terms of phone calls. So it's getting really busy again, and most of, I would say, the vast majority, 95% of the calls that we're getting requesting testing for either exposure or symptoms is related to unvaccinated individuals, and people are converting over from not, or hesitancy to get the vaccine, to now we're setting more people up to get the vaccine now. So that's not unique. Again, this is a trend that's going throughout the entire country. In terms of vaccinations itself, here in Wisconsin, 53% of individuals have had at least a single dose. That's a 1.3% increase from 2 weeks ago, from when I last presented. So, and as far as individuals who've completed fully their vaccination series, now that is almost 50%. So when you look a little closer, you see the age demographics, and you can just see there's kind of this step from younger age to 65 and older. Primarily, a lot of the new infections are occurring in individuals that are 30 years of age and younger. And so now we're starting to see a lot more requests from this age group that are starting to ask for vaccines now, which is appropriate, and as a major cause of new cases. 5.9 million doses have been administered here in Wisconsin, and right now, to the far right, that middle table there, August 12th, 8,530 doses on the average given every day. So we've gone from an absolute low point of 7,700 doses per day 2 weeks ago to now that number is starting to go up, and more people are asking for vaccines. If you look at the table below, the 12 to 15-year-olds, we see that now on a 7-day average, 921 doses are given to 12 to 15. So that's definitely an increase in the number of young people now getting vaccines. And I think it's understandable, given that what the trend is going on right now, it's going back to school. We know that there are more cases, and we know that more of the younger population is getting infected. And so it's not surprising that we are now seeing a rush to get younger people vaccinated, especially that middle school, early high school years, people vaccinated. And this is a definite trend that has been reversing. So that's what's going on. And much of what we're seeing here in Wisconsin is just really a carbon copy of what's going on in the United States. So up until about July 4th, there was an absolute lull at lowest point. But over the last 4 weeks, we're seeing this uptick of new vaccines being offered on a regular basis. So, we're following suit, just like the rest of the country is, pretty much at the same rate, and nothing has dramatically changed in that regard with the US. 167 million doses have been given, and now people are fully vaccinated. So if we look at this table, we see that what's in red here, 71.3% of individuals of 18 years of age and older have had at least a single dose. That's 2% since the last time. Last time I reported this, it was like 1.3% increase. So the numbers are going up. Now, you see this huge 10% difference between single dose and fully vaccinated. That means a great portion, a good bolus of new individuals have gotten vaccinated. And it's going to take about 3 weeks to that being translated from single dose to fully vaccinated. We probably won't see that until the 1st of September. So when we start looking at the total population, I've mentioned this before, that this is that more important number of that critical threshold. When we talk about herd immunity, 70% is kind of like that minimum benchmark area percentage-wise, that we could actually see a difference in the rate of transmission when we get to that 70%. So when we look at total population, 59.1% of single dose, 50% of the United States is totally vaccinated. So again, we're talking about a shortfall of millions of individuals that need to get vaccinated. And I'm based on the current rate, I'm still thinking we're looking at probably the Christmas, New Year's, that time frame where we would get the total population to about 70%. And by that time, we may be talking about other aspects of boosters, third dosing, that kind of thing. So we're getting to a point here of looking at this even more closely as to how do we get to that point. Sorry about that. I've been talking so much today, I got a little frog in my throat. So what's going on in the other states, Michigan, Minnesota, Wisconsin, in terms of the native population? In the 2 weeks time, there have been 65 new cases in the state of Michigan. In the state of Minnesota, 121 new infections, and in the state of Wisconsin, 159 new cases. Now, these are huge leaps comparative to what we were even looking at a month ago. So things have dramatically changed in the Native communities in all 3 states. And in particular here, right here in Wisconsin, we've seen huge jumps in the number of new infections. And these new infections are primarily coming in the form of younger people. We're talking about individuals in their 30s and their 20s and less than 18. So this is very concerning because this really just comes down to, we understand the virus, we understand its transmission, we understand how to protect ourselves, and our primary tool is vaccines. And this is really what it's coming down to, is getting vaccinated. Here in Wisconsin, as of yesterday, there are now 1,104 cases on the average every day. I think yesterday we had almost 1,600 new cases here in the state of Wisconsin. And yeah, if you look at where we are now to where we were back in September, mid-September, early October, we're right at that level, at the beginning of that steep inclined hill there. And, it's kind of hard to say, is this going to be a 2-week bump in numbers that are just going to be flat like this and then start dropping? I'd like to think that'll be the case, but like I said, it really comes down to to vaccines right now. And in particular, we're heading into the school year, which more than likely will result in additional cases because now we'll be in closer contact. Kids will be high school, kids will be going back to school. And so there's going to be an increase. There will be an increase. Looking at what's occurring here in Milwaukee County. So I give these updates on a regular basis just to see where the trends are going. And so as we look from left to right, we see our Asian population 54%, American Indian, Alaskan Native 50%, non-Hispanic white population 52%, Hispanic population 38%, and African American community at 28%. So this half of Milwaukee County's Native individuals have been vaccinated. That is a good number. It falls in line with other demographics here in Milwaukee County. My concern is for the Hispanic population and African American communities that have much lower rates, and that is really kind of a trend that I'm seeing right now when we start looking at the state overall, and I'll show you what I mean by that in a moment. Here, again, we see first dose administered in Milwaukee County. We see, 12 to 25-year-olds. They make up very little of the number of vaccinations that are occurring. And we can just look around and know, we know people that have young families. They have kids in their teens and young adults. And so we all know who's vaccinating and who's not. And this is a really good illustration of that kind of split of where these vaccinations are occurring. Primarily, 55 and older, but that there's a severe drop in number once you start getting into individuals less than the age of 25. So case rates. We start looking at the case rates by race per 100,000. This is as of yesterday. So we have Hispanic population at the highest rate, Native American second, African American number 3. And so, at one point I would have said, this is locked in, there's going to be no shifting of numbers here. Well, they're shifting, and the concern for the African American population is that their case rate per 100,000 is actually going up really fast. And what I thought was a difference between Native population and the Black community, that difference is starting to shrink pretty fast. And quite possibly, we may see numbers in the Native community that may drop to the third highest rate in the state, which is quite possible. Now, this is what I was kind of alluding to before. So this is the case rate by race of all ages in the state of Wisconsin. If we look at the table here on the far left, we see the Native population in orange, African American in this teal. And so when we look at the line graph as this goes in time, we see that the case rate for the African American population is really outpacing everyone else. But if you see in this orange, and this correlates to the increased numbers of cases for natives in the state of Wisconsin, those case numbers are they're going up. And my concern is that we may see the minority populations of the state really excelling in these case rates than the other population. And you can look at this in one of two ways. You can look at it as how is this possible? And I think it directly relates to vaccines. It definitely correlates with the rates of vaccines within the state. So this is case rates. So we look at hospitalizations, really no significant change in all ages. But over the last couple of weeks, the numbers are reflective again. They're reflective of the number of cases by race, case rate by race. And so, again, when we look at um, the hospitalization rates, we see that the African American case rates for hospitalization is outpacing everyone else. But then you see the orange here, that orange line, that's the native population. It's up there. It's about half the rate of the African American population. But again, this is a direct reflection of vaccination rates in the state of Wisconsin. This is hospitalization rates by age. And I go through several of these, and we see the minority population kind of having the much higher rates across the board for all age groups. So vaccination rates. So again, rates of vaccination to rates of infection to hospitalization, that it all relates to one another. And so much of what we've seen in terms of case rates to hospitalist rates, that same profile is starting to show here based on rates of vaccination. So African American community have the lowest rate of vaccines, but have the highest rate of case rates as well as highest rates of hospitalization right now. If we look at the native population, we're kind of second in the state overall in terms of the second lowest, but we have the second highest rate currently in hospitalization and in cases. So again, you start seeing the correlations between rates of vaccine and rates of hospitalization, and this goes across the board for all age groups. So this is really no surprise, and this is the trend that you see as age groups go by. So here is again the case rate between ages 18 to 24. We see this difference of age groups who are that are showing symptoms of COVID. Again, there's a much higher rate, almost double the rate in the African American community to the native population. Even when we start looking at individuals less than the age of 18, again, you see this divide of spraying divide of the case rates less than 18, and we see that the African American community almost has a 3 times higher rate than the native population. So again, this just goes by age groups. Now we're looking at all ages. We look at the rates for African American community, 337 cases per 100,000. Hispanic population, American Indian community, 125. So that's like almost 3 times in terms of case rates, and that's really significant. That is really significant, and this really correlates to the rates of vaccines within vaccinations within the state. Age groups 25 to 34. Again, we see that same difference. So this is really to hone in on on where the cases are, the importance of vaccinations, and there's now direct evidence related to not only vaccination, to the rate of cases, to the rate of hospitalization. Now, fortunately, that all these higher numbers do not translate into fatalities. But the bottom line is that the vaccines are ever more important right now, as if we want to start bending this curve and trend going back down we need to see these vaccine rates go up in all of the populations and all the communities. So Mark and Jeremiah, I'm giving kind of time back to answer any questions or comments that may come up.
Dr. Ignace, thanks for doing the program, especially so close to the school year starting. And also to all the parents out there, just to let you know that be checking with your school, be it private or public, because mask mandates or options, all those school boards are making those policies known. But I know as a parent who had to deal with lots of information coming at me from a school all at once, sometimes you don't see a note and you kind of miss it. So my advice to parents, and I hope yours is too, Dr. Ignace, is pack a mask with your young person, whether the school declares it optional or might be a private school out there that says we're not going to have masks because it's a private school and we have choice right now. So, but pack a mask for that person, and make sure you're paying attention to that school board. Shorewood, Milwaukee Schools, Whitefish Bay, West Dallas, Brown Deer, University of Wisconsin-Milwaukee all have their policies out for people to take a look. So thanks to news sources like TMJ4, I did put in from TMJ the most recent list of schoolings and their policies. So here is your question, Dr. Ignace, around masks. When people wear masks, why are we wearing them, right? So there's a discussion out there, well, it's to protect you, and then the other one is to protect others, and then others are saying masks do nothing based on how people are wearing them, all that, so it really doesn't matter. So that's why we're doing this native to native conversations. One, why do we wear masks? And two, does it matter?
Yeah. Sure. So what we've had several discussions about masks before, and there's varying degrees of mask wearing that goes from a very high level of protection to essentially nothing. And we know the highest level of protection from a mask is an N95, which the vast majority of people do not have. Most people have your more standard, just the blue face mask that everyone sees. Some have created their own, whether it be cloth or the neck gaiters that just flip up. And so we know that surgical masks are very good. We know that the general mask itself are good as well in terms of protection. And when we talk about protection, we're talking about kind of the gross droplets that go your way. Face masks can certainly help, but we're talking more on the microscopic level of passage of virus, whether it be in droplets or in mist. That surgical masks can certainly help protect you, but they can't protect you 100%. So we ask people to wear a mask because we don't know their status, or if they may be sick, we ask them to wear a mask to help prevent the spread, the transmission in the air of the virus. But if everyone wears a mask, again, it's a combination of self-protection and protection of others due to exposure. And we just know from mask to no mask, there's a level of protection now. Nothing is going to be 100%. N95s are the best that commercially would be offered out there for people to buy. But we know that most people don't have those. And so something is better than nothing. But those blue masks that have the loops over the ears, probably the best way. And I hope that helps answer that question.
It does. So now that we know that masks are important and we know how they function, there are events in Milwaukee that are public. We have concerts in the park. There's awareness or gardening sorts of programs that are being held outside. Are we at a point where would you suggest us wearing masks when we're outside? Does it depend on how we're outside? I know Lollapalooza in Chicago is getting a lot of hits because people were close together in the Deer District, certainly after the Bucks game. I don't know if there was any health alerts that came out of that, certainly coming out of a Powwow last weekend.
Yeah.
So recommendation from you on wearing masks outside, or are we just kind of gonna kind of pay attention to what kind of outdoor event it is and what do we need to do?
I think for any outdoor well, let me preface that by saying I would say most outdoor activities that we all participate in, whether it be a kind of a cookout, hangout, walking outside, probably there's no need for a mask in that regard. Now, if we want to go to an outdoor event like the Deer District and the Bucks and the championship and all that, shoulder to shoulder kind of stuff, yeah, there's gonna be yelling, screaming, shouting, good times, blah blah blah, and there's gonna be a lot of misted breath going around, and um, being in that close proximity to others, yeah, I would be a little leery about those types of outdoor activities. The Lollapalooza, we've all seen the videos, just shoulder to shoulder people for look like acres of people just crowded in spots. We know that the Deer District, as a result of all of the celebration of the Bucks, close to 500 people connected with those events. I've seen Lollapalooza. I know Illinois has a much higher infection rate than Wisconsin does. I'm sure the public health is going to come out, and there's going to be even more infections as a result of Lollapalooza's event. And that was, yeah, no, I think what's interesting, um, I know of individuals who actually went to the Bucks game, and we know full Bucks games were, full capacity, and you looked around in the seats, no one was wearing masks. There were people who actually went to the Bucks game, and now they became positive, and the people that they came in contact became positive as well. So there's this cascading, rippling effect that occurred. So it does happen. They are doing fine. That they, obviously still contracted COVID. So you can just kind of, if your gut tells you that the area that you're in, based on the number of people that you see, your comfort level, your radar should go up as to what is safe and what would be concerning. And I would say close proximity. So I would say if you're within arm reach of the next person, within arm reach, that would be about my comfort level, within arm reach. There's nothing science about that being outdoors, but if we're talking about hundreds of people in the same place, I would just look at it from an arm's length. If that next person arm length, I beyond that, I would be okay. Within that arm reach, I'd be a little leery.
Dr. Ignace, one more question. I see Jeremiah's back. I'm going to go to him after this question. And this one is kind of it's not off the wall, but it is what schools, what universities, what other public organizations in our community are going to have to face, just like Potawatomi did, just like Stockbridge did. Some factors that folks may not be taking into consideration when developing, designing, or hosting a public event. Mm-hmm. Here's an example. Maybe I'm from a tribe nation that says, "Hey, the residents of this tribe were fully vaccinated, and let's say 88% or 92, so we're fine, and we're going to have this public event, and we know that we're going to have some health care precautions and post some signs up." Maybe university says, "Hey, we already got a mask mandate out there, and when we have stuff going on outside, we know that our students are supposed to be masked at least." So besides these points of desiring masks and being vaccinated, what do people need to be considering for that public event that they may not be considering. An example, I might have 88% of my population vaccinated and we're going to be fine.
Mm.
But you're hosting a few thousand people coming in and you don't know what their background is.
Mm-hmm.
They're all gathered together in a place, and they're not, the consideration of that variable is you don't know who's coming in,
Yep.
where they're coming from, or what they're bringing.
Yep.
Is there something like that, or some things like that, that organizers or directors or board members that pay attention to this in host communities, what should they be paying attention to, that questions that aren't often asked when it comes to outdoor, indoor events in our community?
You know, you bring up an interesting point, and one that would be a clear example as to how to maximize your your aversion to risk, and that is Summerfest. Summerfest just came out with policy, not a policy, I guess their recommendation for admitting to the Summerfest grounds. Either one, you have to show proof of vaccination, or two, you have to show proof of being tested within 72 hours of being negative. So that kind of addresses both of your questions, even though it really is looking at how to best approach maximizing the number of individuals who may be at the lowest of lowest risk. Well, we know that individuals who are vaccinated have a very low risk of transmitting, and they're protected as it is. But also testing individuals that you don't know the status of, and if they can't show proof of vaccination, at least you know whether they're positive or negative coming in. Obviously, a positive result means you can't come in, but negative. So now you have a whole population of not only just negative, or known negative, and you have a population that is known vaccinated. That is probably the only way you're going to be able to maximize an event like Summerfest, where there will be a lot of people, where there will be close proximity, yelling, screaming, celebrating, all that, with the lowest low risk of transmission. That is probably the best kind of scenario that you could hope for, where you're minimizing risk of transmission. So now, not everyone's going to have the capability of doing that, but outdoor events, possibly even sporting events, may end up coming. I wouldn't doubt if that starts to be an issue for the Packer games.
It's just to follow up, I know that one of your favorite singers at Summerfest is Miley Cyrus, and I know you're super excited to see her come in. It's got a little bit of that tribal background and all that. So I expect, what I'm hearing from you is you're showing up at the front gate because it's required with your IHS kind of beaded lanyard, laminated ID that shows I've gotten this vaccination. So here's the follow-up. Going around here. Is I don't have that card. I got vaccinated at the Ignace Health Center, and boy, I'm excited. Now I lost it. What do I got to do to get that card before I show up for that Chance the Rapper thing that's going to happen? What do we do?
Yeah, that's going to be interesting. What do you do? Because I'll tell you what we do. I'll tell you what we do. We know of every single person that we vaccinated by name. We have record of it. Now, every person that gets vaccinated has to be uploaded. Their information, who they are, date of birth, blah, 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 has to be uploaded in the state, resource that will say, on this date, we gave Mrs. Jones, Mrs. Smith, this vaccine with this lot number. And so I don't know if the state's going to be able to turn around and say, you know what, we have a record of each individual that's been vaccinated in the state of Wisconsin, just call our number or download whatever to show proof. That could be one way. The hard way is if you didn't keep your card, you could possibly go back to the original site that you had it, and maybe they have the card that may show that you've been vaccinated by that site on that day by this lot number. However, I don't know how well, I can only tell you what our site has done, our agency. I don't know what other agencies or other health centers have actually done. If you went to Aurora, if you went to, you know, Freighter or some other major health system, I don't know what they're going to do. I don't know what the health systems are going to do, other than what I know what we could offer.
So I'm going to turn this over to Jeremiah, and he's a Summerfest fan too. I know it. I can feel it. I can see his excitement. Styx is going to be there, right? T-Pain with his auto tune. That's right in Jeremiah's wheelhouse when he was a kid. So Jeremiah, you got any questions, input for us? From
a little bit. I just wanted to bring up, and I apologize if you had discussed this already, as I was kind of running back and forth. We are currently having our back to school event outside the clinic as we speak, handing out school supplies to Native youth. And with that in mind, you've mentioned this before in town halls and people, kids going back to school, I think as early as, I want to say, next week. Masks mandates kind of varying from district to district. If you're just talking directly to, some parents or some, maybe some kids that are even listening, let's say your district isn't mandating masks, would you suggest that, that student or, even teachers out there to get in the habit of putting those masks back on?
Yeah, you know what, because we're talking about 3 months since school ended to now school beginning. We're talking about 3 months of pretty much mask-free living, especially little people and young teenagers. It's going to be hard to get them back into the habit of wearing masks. And I know in the school district that my kids are going to be going into, they have 3 levels of participation in school. One is in person, which obviously you won't have to do wear a mask. But in person, there's 2 categories, one that is required masking and one that's recommended. Now, what is kind of, and I may say something that people may feel that I'm out of order on, but we know that younger population, yes, they do. There are infections, there are transmissions occurring, but at a much lower rate than older adults. So when I talk younger, I'm talking about less than 10 years of age and younger. On top of that, we know that that age group has fewer hospitalizations, fewer ICUs, probably the least of all age groups. And so looking at studies that have actually been published, reputable studies that have been published, there hasn't been showing a clear indication that mask wearing less than 10 years of age reduces the transmission or provides any added benefit than individuals not wearing a mask. There's just not enough studies out there to suggest that. It's inferred, I think it's inferred that all people who wear masks have the lower transmission, but it hasn't been shown in people less than the age of 10. In adults, yes, no problem, but not in ages less 10 years of age or younger. So I can understand where school districts may hedge their bets one way or the other, or be on the fence and have districts that do required classrooms versus recommended to in person. I know this doesn't answer the question, but it just goes to show that there isn't a uniform approach to this. And even if all kids, and I think we saw this late winter, early spring, that kids that were in person, some school districts didn't have any mask requirements, some did, some had some cases, some had very few cases, but at the end of the day, when it was comparable to everything else, the rates of kids infections were remarkably a lot less than teenagers and adults. So, if you're asking about differences between high school, middle school, and elementary, yeah, I think there is difference. I think once you get into high school, those masks become probably more important. Middle school, elementary, probably not as much. So there is a difference, I think, in terms of what's school age, what would benefit the most.
Evan, one more question about the, so locally we had there was a powwow being planned for August 21st in St. Francis that recently has been announced as postponed to the spring of 2022, a date unknown as of yet. Do you foresee, and I know we were talking about Summerfest and some bigger events coming up sooner, in September. Some NFL stadiums, will be requiring vaccination proof of. Do you foresee, and of course, there was the news of the recent, I believe it was the Forest County Potawatomi powwow that had some COVID-related cases. Do you foresee? I mean, I know that's a far, a few months out, but would there be, when these maybe powwows or certain events like that start coming back in the spring of 2022, would you foresee them approaching the idea of requiring vaccination status, or maybe by that point, hopefully we're beyond that?
Yeah, I'd like to think we would be beyond that to more of a resolution to kind of really downgrading COVID by then. You bring up an interesting point that several tribes had canceled their annual powwow, and I had unfortunately had to make the hard decision based on the trends that I saw were going on right now, leading into even the month. We're in August, and I formally had decided to cancel Glick's Red Shawl Gala. So we are no longer hosting the Red Shawl Gala that was supposed to be in October, just because what I was seeing as the trends of what's going on in public and even major venues. It was an unreasonable ask for anyone who wanted to participate in our Red Shawl Gala, our fundraising event, to do what Summerfest was planning to do: proof of vaccine, negative COVID test, just to get in the door. I mean, it became logistically a nightmare to be able to handle, and so these are these hard decisions that need to be made, and it gets made both not only individually but collectively, and collectively as tribes have canceled or postponed the powwow. Two weeks from, what was it, the 21st? So these are not, nobody likes making these kind of decisions of downgrading events, or if you wanted to host events, you're going to have to ramp up your assurance that participants who come can freely come, but also without fear of contracting the virus. So I'd like to think that this spring that we can downgrade this pandemic to an endemic, and really look at the number as being much lower, and less risk of transmission and severity of illness. That would be the most ideal picture that everyone would like to see. I don't think anybody can forecast that right now.
Dr. Ignace, we've gone over our time. We did get a late start. Apologies to those of you viewers. For those of you that watch on tape, thanks for being and joining us. My word before I hand this back over to Jeremiah and Dr. Ignace is, for all of my relatives out there, this is a native to native conversation. We might have an opinion of COVID-19 and what it's about and what's going on with it and mask wearing. But we do have individuals who are compromised in their health.
Mm-hmm.
We shouldn't be putting the hosts of family gatherings, even be they outside, as to they're telling us whether we need a mask or not. just bring it.
Hmm.
And you're going into somebody else's house, and I get it, you're related, but you know, your grandma and grandpa, they're usually going to tell you yes to whatever you ask because they're your grandma and grandpa. But take precautions so they are put in a difficult spot. We need to safeguard our community, and that begins with us making responsible decisions at this particular moment in time. And we're not compromising people that shouldn't be compromised, because they're of such good nature and good hearts that they want to accommodate everybody. We should be accommodating their health and making their decisions easier. So that's it for me. Thanks everybody for tuning in. And Jeremiah and Dr. Ignace, I'll turn it over to you. And thanks for staying over just that little bit. And please check out the links that Jeremiah and I have shared, so you can be keeping up with all the school updates as they come in. And Jeremiah, maybe you can talk about the links that you're sharing too, so as people are watching on tape, they know what they can check out. Thanks everyone. Dr. Ignace and Jeremiah, over to you.
Thanks, Mark. Jeremiah,
Yeah,
yeah, go ahead and talk about those postings.
Oh yeah, real quick. So as you guys were discussing, I found some links based on, questions on, how to, get another vaccine card, or, get that information, where that would be available. So posted a link on that. Fox 6 put out. Also did find a little story on how many cases have been related so far to the Lollapalooza Music Festival. And as Mark said, there was a nice story on kind of just putting all the schools in the southeastern Wisconsin area that are requiring masks this fall. So those are out there for everyone to see, and those are available in the Zoom chat as well as on the Facebook live stream. I did also want to take a minute to do some obligatory self-promotion. I guess not self-promotion, but Dr. Ignace promotion. He'll be on a nice, not virtual, but broadcast town hall on Channel 12 WISN on August 19th. I believe he'll be slotted in there's an 11 to 1 slot. So keep your eyes and ears peeled for that. It's going to be a kind of a roundtable of doctors from the southeastern Wisconsin area discussing what we're talking about today. So it's, just a nice wider audience in the Milwaukee area. So keep your eyes and ears peeled for that. Yeah, again, thank you all for joining us. And Dr. Nace, of course, I'll leave you with the final word today.
Yeah, just a side question, Jeremiah. The link to Lollapalooza, did they actually give a number?
Yeah, I believe in that link, it said it was 203 cases.
So far?
So far, yeah.
Yeah, yeah, go ahead.
Oh yeah, sorry. Most stories that I found as far as links were saying, that was as expected, or, better than expected, I guess. So nothing that really alarmed anybody. Nothing like a super spreader event, where there's thousands and thousands of cases or something like that. So it seemed to be, it kind of went off as they expected. I know I did see a report from somewhere that they said, and I'm not sure if they were requiring or just asking of your vaccination status when you entered the festival, but they did note that there were 90% of attendees said they were vaccinated. So whether you believe that or not, I'm not. That seems kind of high, but
all right, that's almost laughable. 90% is remarkably high, and when we talk about, I'm sure the population that goes to Lollapalooza are probably less than 30 years of age, and that's the least likely of groups to be vaccinated. So, yeah, that's a good one. So, after today, it really is highlighting correlations between what we know in case rates. Vaccination rates can lead directly to hospitalization. We're starting to see a divergence of cases to vaccinations to hospitalizations, and given the trend that has been occurring here in Wisconsin to the native population, that's a lot of cases. It's a lot of cases in a short amount of time. And it does remind me of what occurred a year ago, 12 months ago, before that high incline of cases here in Wisconsin. So this really all goes back to the notion of getting vaccinated. And it's going back to school. It is our younger adults and younger population. And I just want to reassure people that the best approach here is looking at how you can protect yourself, your family, and your loved ones and relatives by getting a vaccine. So do contact us if you want, or your own provider, and a location where you can get scheduled for a vaccine. Just on a side note, Carol, I will email you. I will let you, I'll get it a hold of you. Not a problem. So until next time, stay strong, everybody, and get your vaccines. Take care.